Good morning, friends. Welcome back to my YouTube channel Medical Classes by Dr. Srinidhi Kumar Acharya. Please don't forget to subscribe to my channel and also please give your valuable comments. You can also visit the playlist. In the playlist, I have provided almost all the topics in a systematic order. You can make use of it. Thank you very much. My dear friends, continuing with the topic fever in children. So today we will explain. Today we'll try to understand the pattern of fever in tuberculosis. Yes, tuberculosis is quite common in India. Of course, it is also common in children. There are so many factors which are favorable for that is existing in our day-to-day environment, especially in Indian situation. So tuberculosis is quite common in children too. Usually adults, they will transmit the tuberculosis to children rather than children to children. Transmission is very less and no, you can say there is no transmission, but adults always transmit the tuberculosis to the children, because in the children the pattern of tuberculosis is different from that of the adults. So therefore a child suffering from tuberculosis spreading the tuberculosis to another child is quite less. But if the child come in contact with any adult tuberculosis patient, the chance of transmission is very, very high. Anyway, the reason is in childhood tuberculosis there is no formation of the cuff, there is no formation of the sputum rather, there is no formation of the sputum, so the chance of transmission is less. Whereas in adult tuberculosis always there is formation of the sputum and therefore chance of transmission is more. Anyway, about the fever today we will talk about. Usually we will get evening rise of temperature in tuberculosis, especially if you are talking about the adult standard. In children, of course, this pattern will not be seen. Okay, in the children we have totally a different pattern of tuberculosis fever. It's a continuous unexplained fever which is existing for more than 10 days, 15 days, etc. So that is always a big suspicion for tuberculosis in children. Whereas in adult pattern, when I talk, usually we will get evening rise of temperature. The question comes, why there is evening rise of temperature in tuberculosis, isn't it? See, in tuberculosis, actually, it is not about the evening rise or morning rise, etc. Tuberculosis means infection is there inside the body and bacterial infection is going on, and the nature of the tuberculosis is, bacteria is, it causes the low grade fever. Actually, in a patient of tuberculosis, round the clock there will be low grade fever, very low grade fever, maybe 1 degree like that. Low grade fever will be there. But actually what happens is, our normal body temperature is almost 1 to 2 degree less in the morning hours when compared to the evening. Okay, try to understand this. Normally in all the human beings, the body temperature in the morning hours is 1 to 2 degree lesser than the evening hours. Okay, so a normal person will have temperature of 97 degree Fahrenheit during the morning hours and 98.6 degree during the evening hours. I am talking about a normal person. Even a normal person also having the body temperature of 96 to 97 in the morning hours and about 90.8.6 in the evening hours. Now if a patient of tuberculosis comes to you, in a tubercular patient who has already got a low grade fever, say for example 1 degree of low grade fever is there, when you take the morning temperature, the temperature will be somewhere around 98 because in a normal person it will be 97. Now here it is 98, so you measure it is 98, so actually it is 1 degree greater than the expected, but so when you measure it as 98, you consider it as normal. So you say in the morning hours there is no fever. But the same patient, when you take the temperature of the evening hours, so he will have 99, because in the evening hours in a normal person also the temperature is 98.6. So 1 degree higher low grade fever, so that will be showing 99.6. So we assume that in the morning hours there is no fever and in the evening hours there will be fever. But actually talking, he has got the fever round the clock, a low grade fever is there. But as the temperature in the morning hours normally comes down to 1 to 2 degree, so we will count it as a 98, which is normal. This is one part. So same patient when goes goes at evening and measure, it shows 1 degree increase and the patient feels fever. This is one cause, one of the specialty of the fever in tuberculosis. That is, it is the same thing is told here. But actually, low-grade fever is there continuously. In tuberculosis, the organism is less virulent, so there will be always a low-grade fever. Because less virulent in the sense it is very dangerous, but it is less virulent. That means it's not releasing the toxins so fastly. That's all. Okay, but it is slowly causing the problem. Therefore, there will be mild grade of fever will be there continuously. One point. Second important issue related to tubercular fever is another important cause for tuberculosis is basically a immunological disease. Although it is a bacterial infection, it is actually T cell deficiency, macrophages and T cells. So their deficiency actually leads to this problem. Okay, that means further progression of the pathology takes because of immunological deficit there. If the immune system is okay, then there is no much further progression of the tubercular bacteria. But that interferons and all those things, formation of the primary complex and all, so we can study that. Okay, because of that issues, there will be actually T cell deficiency, cell mediated immunity problem will be there. Cell mediated immunity problem will be there. So everything depends upon the immune response of the host. If the cell mediated immunity of the host is less, then tubercular bacteria is more progressive. If the cell mediated immunity of the the host is good, then tuberculosis is not much so progressive, and there will be healing by formation of primary complexes, especially in children. Anyway, this immune response goes on changing by time to time. So once it increases and once it decreases. Now, the immune response which the body is showing, it is not always uniform. Sometimes it increases, sometimes it decreases. So when it decreases, there will not be any fever. Try to understand. When body immune system is fighting against the tubercular bacteria, you will have fever. When immune system is not fighting against the bacteria, there is no fever. There is no fever. So fever will be there only when the fight takes place. If the tubercular bacteria is more powerful than the immune system, then the immune system will not fight, and as a result there is no fever also. But when immune system is good and shows a guts to fight against the tubercular deadly bacteria, then there will be a fight and then there will be fever. So fever is coming, therefore sometimes the fever is coming and sometimes the fever is not coming. Okay, but one thing is very clear, the fever which is coming here is with a long interfebrile period. Because although tuberculous bacteria is a bacterial infection, tuberculosis, the basic cause for its further progression is immunological cause, cell-mediated immunity. If it is less, then it's a further progression will be there. So it can be counted under the immunological disease also to some extent. Ayurveda says that it's immunological disease rather than the infectious disease. Okay, so the fever will be coming after a long interfebrile period is one of the classical nature of immunological fever. So here also fever is coming after a long gap. Although low grade fever is existing throughout, the exhibition of the fever is after a long interfebrile period. Every day evening hours the fever going to rise. Every day evening the fever going to rise. Okay, so that is maybe once in every 12 hourly or once in every 18 hourly the fever is coming. So long interfebrile period, that's a very classical feature of a immunological fever. So therefore tuberculosis can be also counted under the same. Another is the immune response of the body actually depends upon the sudden multiplication of the organism in the body. That is very important. When the immune system shows the response, when tubercular bacteria is growing and it is multiplying and it is attacking newer and newer cells, then the immune response goes on increasing. When the tubercular bacteria is dormant at a stage and it is not releasing any offsprings or any toxins, etc., then the immune system also gets silent. Okay, that's the reason why there will be sometime fever, there is no fever. Okay, so when tubercular bacteria are produced and released, there will be sudden immunological response and there will be fever. So evening rise of temperature can be also seen in another condition is usually we'll get evening rise of temperature in tuberculosis in adults. But another condition where even rise of temperature can be seen, so that is usually chronic sinusitis. Even in case of chronic sinusitis also, we will get evening rise of temperature. So this is about the specialty of the tubercular fever. We have got so many doubts about the tubercular fever. Why the fever is evening rising? It is actually not like that. Once the tubercular bacteria goes inside, means it is slowly developing, and it is always causing actually low grade fever. But we are not able to appreciate, because in the morning hours usually the temperature come down. Number one. Number two, this is immunological disease. Number three, the host difference changes from time to time. Okay, if our immune system is in a mood of attacking, then it will go and fight. And when the fight, there will be fever. If it is not in a mood of attacking, then there is no fight and there is no fever. So these are some of the special issues related to tuberculosis. Thank you very much. And in the next class, we will see some of the common investigation that we have to see, or we have to perform in case of fever, and when we have to go for investigation, and what are the most common investigation that we have to do to get the maximum information. That we will see in the next class. Thank you.